When someone gets chemotherapy and they say, now you're cancer-free, there are still circulating cancer stem cells in the blood. And those are the troublemakers. Those are the ones that go to other parts of the body, like the lung or the brain or the bone or the liver, and take up shop there and then grow. And at that point, they become more resistant. They never talk about cancer stem cells with patients. They're only getting partial information.
The Vidal Speaks podcast.
Episode 36, Valerie Warwick, from Oncology Nurse Specialist to Natural Cancer Coach. Welcome to Vidal Speaks. My name is Deborah Vidal, former 11-year LPGA golf pro turned classical homeopath, certified plant-based nutritionist, and wellness coach. Each week here on Vidal Speaks, we bring you knowledge, inspiration, or natural remedies to help you take charge of your health and feel your best. I believe health is freedom and knowledge is power, so tuning in each week will give you the power to take steps towards freeing yourself from the chains that hold you back from having the energy to do all you want in life. No matter where you are in your journey of wellness, Vidal Speaks can help. I promise. Happy Vidal Speaks Day today, my dear listeners. I hope you're having a great day, and I promise it's going to be an even better one once you hear all I have to share with you today with my guest, Valerie Warwick. I know I get excited about every show. That's because I love sharing so many great ideas and tips and experts with you guys, but today's show is filled to the brim with information. Valerie's an RN, or a registered nurse, who specialized in oncology for 17 years. Now that's a lot of years to watch thousands of patients with different kinds of cancers in all different stages receive the standard cancer treatments offered to all cancer patients by the allopathic doctors. So if anyone should know what works and what doesn't, it would be someone in this position. Valerie's patients taught her that suppressing their symptoms and lowering their immune system with the standard treatments was not the answer, and after many years she became frustrated with what the medical profession had to offer and with her lack of being able to really help her patients live or heal. She tells us a couple stories where her patients responded to very simple nutrition, and that began a journey for her that would lead her to leave her profession and to study in great depth nutrition and alternative cancer treatments so she could really help people heal from cancer. I can only imagine how hard that must be because you spend so much money on your training, and she was a 17-year specialized oncologist nurse. And how hard it must have been for Valerie to one day realize that the treatments her patients were getting were actually causing them to become more ill and more sick. So I give her a lot of credit to be able to leave her job and do what she felt was really necessary to help people. And so now Valerie has a business of coaching cancer patients, and I'm so excited about her work because this is something we really need, because people who choose not to do the traditional treatment, they often have no support of their doctors, no support of their friends, and even family. And when you hire Valerie as your coach, you can just relax and you can use all her expertise to help answer your questions. And she uses so many cool tests and therapies, so really she can guide you into very individualized treatments that will be very specific for your kind of cancer and for your test results, which means that you can successfully target your cancer with very specific nutrients that have been shown in a certain lab work test to work for your cancer. She's going to talk about that today, and I can't wait for you guys to learn this. Also, she's really knowledgeable about so many different alternative treatments, so you can feel that she'll help you cover all areas of your healing, from nutrition to finding doctors, to what tests to do, to reading the test results. And she knows so many alternative cancer therapies. So really, when you're diagnosed with cancer, you don't have the energy or the time to do all the research that Valerie has done and can help guide you through. So really consider, if you are sick and you need a coach, give Valerie a call. Her prices are so reasonable, and this is what's so exciting, because usually a person, when they're diagnosed with cancer, they feel like, I can't afford to do anything natural. How could I afford a coach like Valerie? But I'm telling you, she is affordable, and she will go over her rates during our interview, so stay tuned for that. Mainly, I just want to say, if you or anyone you know has cancer, just be sure to check out her website. It's mywellnesstutor.com, and give her a call so that you can discuss your situation and hear her plan for you. You won't regret it. I hope I won't ever need it, but I can tell you, if I did, I'd use Valerie myself. She's kind and very knowledgeable about both alternatives and the medical options. And she's affordable, so how do you beat that? Okay, now before we go meet Valerie, let me tell you a little bit about her. As a young adult caring for both of her ill parents, Valerie realized her natural ability as a nurse, and her interest in the healing arts grew. Valerie graduated with her nursing degree in 1997. Her nursing career led her into oncology, where she spent 17 years in direct patient care in both the inpatient and outpatient setting. During that time, Valerie obtained her certification as an Oncology Nurse Specialist and developed a strong clinical background in all aspects of patient care. In 2009, Valerie's focus began to change after experiencing her own health challenges. Using whole food nutrition and the principles and practices of functional and orthomolecular medicine, Valerie realized a profound change in her own health as she incorporated these practices in her own life. She realized that allopathic medicine perpetuated a shift in metabolism and in the way that the body was able to utilize the basics of water, oxygen, and nutrients. It was a profound awakening, and it completely changed her paradigm. She realized that treating illness by suppressing symptoms and the body's immune system never brought about healing to anyone. Valerie realized that toxins and micronutrient deficiencies are the most widespread and dangerous health condition of the 21st century, and that true healing can only come by removing the burdens of toxins, followed by restoring the immune system through nutrients, real nutrient-dense food, water, oxygen, sunlight, movement, spiritual awareness, and the joy of healthy, loving relationships. Valerie's desire is to help others rediscover and restore their health and vitality by supporting their body's own ability to heal itself given the right environment. Valerie's passion and life purpose is to help in this regard. And lastly, Valerie's an Oncology Nurse Specialist, a certified micronutrient specialist, and certified in electrolymphatic therapy. Okay, you guys ready? Well, get your learning ears on today. Here we go. Hi, Valerie. So great to have you on the Vidal Speaks podcast, because there's millions of people out there that need to hear your message and that need your coaching. So I want to help spread the word for you, but it's also my job to help others learn to take the responsibility to heal themselves. So welcome.
Thank you, Deborah. It's so great to be here with you today and your listeners.
And you know, we're really excited about having you here because you were an oncology nurse, and I know you were a nurse for 17 years in oncology, and you can tell all of us about your medical training just to become an oncology nurse so the listeners are aware what it takes to get there. So why don't we start with that?
Yeah, sure. I graduated from Idaho State Lewis and Clark and first graduated at North Idaho College in North Idaho. When I began working in the hospital, I was working on oncology on the weekends, and they invited me to join their team on a full-time basis, which I was excited to do. After a few years working oncology, I took an extra exam to get my certification in oncology, a special certification. And I worked on oncology for many, many years and learned so much and love the patients, love working on oncology, love the science of it, the whys of oncology. And I've always been someone that asked questions and hopefully looked a little bit deeper, but it did take me a long time to realize there was some problems after many years of observing the patients.
Well, I know oncology can't be easy for some people because in some ways you're seeing a lot of people pass, and that's hard for nurses, I know. But you must have some story behind the nursing that led you to even want to be a nurse, because usually people that become nurses are kind of caretaker individuals. So can you tell us all about what got you into even wanting to help people?
My great aunt was a nurse. My mom was in the nursing field. My sister-in-law is a nurse. So I really grew up in that background of nursing, and I totally have that caregiver personality. When I was a young teenager, my mom developed multiple sclerosis, and my dad, after that, developed throat cancer. And so during my young adult years, I was caring for them.
What a, early responsibility you had as a young adult to have two ill parents.
Yeah, it was tumultuous in a lot of ways. I learned a lot, and it was pretty natural for me. So it was easy in some ways, but difficult in another. But I did learn so much, and I saw firsthand that allopathic medicine didn't really have any answers for either of my parents that were good.
And how did that story play out with your dad's throat cancer and your mom? Are they both living? Are they deceased? How did that work out?
No, they both passed away. My mom actually lived longer than my dad. My mom, who had progressive multiple sclerosis, eventually she was paralyzed from the neck down.
Jeez.
Yeah, she was totally mentally capable, but she couldn't move anything except her head.
That's really such like a life imprisonment when the mind's all there and the body's gone, isn't it?
It is. And she was a remarkable woman, really remarkable.
Wow. And what about your dad? When did he pass?
After his diagnosis, he passed away in about a year and a half.
Did he do traditional, chemo radiation?
Yes. He did surgery, which was a radical neck, and that's what they used to do in those days. I don't think they do it so much anymore. Mm-hmm. But a radical neck is when they do an incision from under the chin, around the side of the neck, all the way down to the mid-chest. They open the flap, and they take out all the muscle and the lymph nodes. Wow. Yeah, it is radical for sure. And after that, he had, I think, it's hard to remember, but I think that I know he had radiation for sure. The radiation was after the surgery, so it impaired the healing of the neck. And so that incision and it was very necrotic, so it just kind of opened up. And they took part of his tongue as well. So, he couldn't eat anything. So he had a PEG tube in his stomach. That's how he got his nutrition. And from that, I learned how to use a PEG, and I learned that you could put anything in that PEG, you blend it up, and he was eating what we were eating. In those days, they didn't have Ensure or any of the liquid nutritionals that go into the PEG tube. So he ate what we ate.
Which was probably a lot healthier to do it your way, right? I mean, it depends, because Ensure is what they feed these poor patients on in the hospital, and it's such garbage.
Yeah. It's total sugar. Actually, it's carbohydrates that really don't have the kind of nutrition that a cancer patient needs. And I wasn't really aware of nutrition in those days. I was looking for answers for sure, but I was looking towards the traditional medical community and they didn't have any answers. So basically we lived in a very rural area. So there was no visiting nurse. I was it. And it was many miles to a doctor.
Well, I can see we have so much to talk about today. I'm excited about this. And now we can see how you're setting the stage for caring for your dad with this, terminal cancer got you probably, that was a big reason what got you interested in helping other people in oncology and with cancer. But I know, and the listeners know my story is my mom passed, but she passed from the side effects of Guillain-Barré, which is from the flu shot. So she took a flu shot immediately, got Guillain-Barré, was in a coma for 2 months. And when she came out, she was also paralyzed from the neck down. She did learn to regain that, but she was so compromised from all the vascular damage and stuff that she passed later with that. And I know from that 2 months when my mom was in the hospital, plus all the months after trying to rehab, wow, nurses, I had a whole nother level of respect for nurses because even though my dad is a medical doctor actually, and, I grew up as a kid going to rounds with him at the hospital and I always knew what nurses did, but wow, not until then did I realize what nurses really do. And they're there for the family. They're there for the patient. They're doing everything. It was so eye-opening to me. So I have really a lot of respect for you that you can be an oncology nurse because I can only imagine how intense that is and how many patients you're losing and having to say goodbye to. That can't be an easy thing. But there's so many different types of cancers now, and there's so many people with cancer. So I assume that there came a point for you that you realized that people really aren't getting better from what they're doing, right?
Yes, that's exactly right. At first, in my early oncology years, thought, how can giving somebody these drugs are so toxic. How can giving somebody such a toxic drug help them to heal? And I thought to myself, well, I'm just learning. So I'm going to observe this and learn because I really didn't know anything about oncology when I first began truly, just what I've experienced. So I was open and receptive to learning. After years of observing, I saw that the patients just became more and more ill after the chemotherapy. Yes, the chemotherapy does kill cancer cells because it kills cells. It's very cytotoxic. That's what it means. It's toxic to cells. So it kills cells. But the problem is it doesn't restore the patient's health. They were sick before they got cancer. They got cancer because they were sick.
Yes.
There was a root cause that caused them to become sicker and sicker and sicker until they got cancer. So getting rid of the cancer cells doesn't cure cancer. It helps. It helps lower the tumor burden. It helps lower the cancer cells, but it also kills the healthy cells. And eventually, if you keep getting more and more chemotherapy, you become more and more toxic, and then your body is unable to recover. So when someone gets chemotherapy and they say, now you're cancer free, there are still circulating cancer stem cells in the blood.
That's exactly what I was going to ask you, because when you were talking about chemo killing cells, chemo does not kill those circulating cancer stem cells. Am I correct?
That's right. And those are the troublemakers. Those are the ones that go to other parts of the body, like the lung or the brain or the bone or the liver, and take up shop there and then grow. And at that point, they become more resistant.
And is it fair to say, because I'm trying to remember my pathology, but Those stem cells, that's why they can go anywhere, because a stem cell can become different things, right? So it can go to the bone, or it can go to the brain or the breast or the wherever. But so as those circulating stem cells, they're not killed with the chemo. And as they circulate, then if they go to the bone, then metastasis goes to the bone. Is that correct?
Yeah, that's right. There's still, when it's in the liver, and if you have a liver tumor and they biopsy it, they can still get information that this came from there. This is from colon cancer, say, it has characteristics. If it's somewhat differentiated, sometimes it's totally undifferentiated. That means it's very malformed. It's not the same at all. But yes.
And how many people that have cancer that do chemo are told that chemo will kill all their cancer cells, but it will kill the stem cells that are cancerous? That
is so important. They never talk about cancer stem cells with patients. I never even heard about it when I was nursing in oncology. They never talked about cancer stem cells ever.
Because in some ways you just end up feeling duped. You know what I mean? If I were a cancer patient, I've lost so many friends already to cancer. It just breaks my heart. But if I were a cancer patient and I found out later, and we're going to talk later about statistics, that what they told me was a lie about the statistics that they told me. And if I found out later that chemo never touched my cancer stem cells, and that's what could make my cancer regrow again, and they're still going to be living vitally whether I do chemo or not, I feel like then I've been lied to. And I can understand why cancer people feel angry in the end, because they weren't really told the truth.
That's right. They're only getting partial information. I'll use an example of breast cancer. So the woman or the man will get a mastectomy. They'll remove the breast, and that's where the tumor is. So you feel like, wow, I just want to get rid of the cancer, right? I just want it to go away. Get rid of it, do the mastectomy. Of course, they'll take some lymph nodes, probably, at least some. They may do chemotherapy. And then after your treatment protocol is done, they'll do a CAT scan or PET scan, and they'll declare you cancer free. And then they'll just say, well, just come back, in 4 months, we'll do a recheck, go live your life, go be happy, and you're good. But they never measure the circulating cancer stem cells. They're not there yet in their treatment. It is available for people. So I want people to know you can measure your circulating cancer stem cells and know exactly where you stand. And it's so important to do that.
Okay. So that we'll get to that, because is that when you're going to talk about testing for us? And that's probably where we'll get to that. But yeah. A question that I have, does a PET scan pick up a cancer stem cell or not?
No, it does not. It's CAT scans, PET scans, colonoscopies, mammograms, X-rays. They're all late detection tools. They are not early detection tools as we're informed that they are. They're not early at all.
Well, I know that in mammograms, I certainly don't recommend them in my practice. People would ask me, I always use thermography, because once you set that baseline, and I'm going to have my thermography person on the podcast in a few weeks to expose people to that idea. Mm-hmm. So it sounds like it's the same for other ways so X-rays, mammographies, PET scans, all these things, we can't detect cancer stem cells.
No, they only see actual tumors that are formed. And so that is at a later stage. So I think it's 2 millimeters or greater that they can find those things.
And I've read that once you can detect a tumor, that your cancer's been growing likely years, some say 10 years, but likely years before it even gets to that point. So it's kind of, the process has begun. My homeopathic teacher, he always says cancer is not a disease, it's a process. So the cancer process has begun years before that tumor formed. Like you were saying, that if we don't get to the underlying cause that caused the process to go wrong, we can't really fix the cancer until we can go back to the cause and get the body to work correctly again. So you must have seen, no matter what kind of cancer, then you probably saw a lot of same symptoms, because when someone's getting chemo radiation, it wouldn't matter probably what kind of cancer they're getting. Maybe one makes their hair fall out and one doesn't, but generally it's making them all weaker and sicker, I would assume was a lot of what you saw in nursing with chemo and radiation, right?
Yes. It's funny how our paradigm and our view can be skewed by what we're taught. So I was seeing when you lose your hair, you get thin. Even though I knew that chemotherapy was so very toxic, and I observed the side effects of hair loss, diarrhea, loss of appetite, nausea, vomiting. These are just the outward signs. The white counts, the blood counts going down, the platelets going down. I saw them as they're ill because they have cancer. But that's not really true. They're ill because we've made them so much more ill using these toxic drugs. They're not this ill because they had cancer. The treatment contributed to their illness.
Yeah, and it's kind of really backwards. I've tried to guide patients in my practice that are faced with maybe doing a surgery for a cancer. And then the doctor and many doctors, they recommend that they start their chemo like the next day. First of all, they're in shock. They haven't even had 1 second to process the emotional grief of being told they have cancer. This happened I lost 8 friends on the tour to breast cancer, and all of them did traditional treatment. All of them died, and all of them told me that the chemo was the worst of anything, worse than the cancer itself, that they felt like the chemo put them to the death because it made them so ill. And, some of them recovered and lived another year or 2 or 3, and then it metastasized somewhere else and they passed. But the bottom line is it just feels so barbaric what we're doing to take a person who has an already weak immune system that was able to be sick enough to get a cancer. And then we're going to say, and now, immediately now, you need to start chemo tomorrow. We've just done a surgery. You've just been diagnosed with cancer. You have an emotional shock. Your immune system's down. You're down from a surgery, and now they're going to fill your body with more toxins. If someone really wanted to do that, like I had a patient that had throat cancer and she was adamant to do it. And I said, take 3 months and build your immune system up, do like vitamin C IVs and do all kinds of things for your thymus gland and feel better. Because she was still crying every day over the shock of her diagnosis. She was in no position to do it. But they get so feared into doing it immediately that 1 week of waiting or 1 month of waiting is going to make the biggest difference. And for most people, that's not the case. So I think what you're saying is a really big point here, that even if people choose to do chemo and radiation, we all have the freedom to make our own choices. But if we could do it at a point when our immune system's not at the bottom of the barrel, it would be more helpful.
Exactly. And statistics show, now I'm speaking to those folks that are doing chemotherapy, statistics show that if you do some integrative medicine with that, the outcomes are much better. The message that is given from allopathic medicine that it will interfere with your treatment, that is not true. Statistics show that those folks that integrate natural substances to help support their immune system have better outcomes.
Although when patients ask doctors, can I do, juicing? Can I do raw food? Can I do some nutrition? Often they're told that it either won't make any difference. And I've even been told by some people that they were told not to do it, that it would make the chemo not work because it's a detoxifying to eat a clean diet and it might push the chemo out of the body. Have you heard that?
Yes. Now, I don't recommend like a heavy detox while you're doing chemotherapy because yes, it would do that. That detox, that major detox needs to come after. But while you're going through treatment, of course, eating a healthy diet is so important. and getting nutrition for your cells is so important. We used to teach people, don't eat raw foods, only eat cooked foods. And I think now they're kind of changing their tune on that. And that's because people become neutropenic, which means their immune system goes down to nothing. And they're afraid that the live bacteria on the foods, on the fresh fruits and vegetables, would cause them to have an infection. But I think now in allopathic medicine, they're kind of changing their tune on that one. But
are they changing their tune at all on nutrition having any impact?
No, I don't think so.
Yeah, hopefully someday.
Yeah.
I'm sure. So what were some of the things that you saw in your cancer nursing history that, maybe began to make you question what you were doing?
Right. Well, when I first was in oncology, I did have the fortune of working with a lot of great nurses who took me under their wing. They taught me, wonderful aspects of nursing and oncology. And I worked with very good doctors. So they did look at the patient's functional status and say, I'm sorry, at this point, we're not going to do any more chemotherapy because your functional status is poor and you won't tolerate it. Then I changed hospitals in another state and observed different kind of care where they gave chemotherapy to the very end. Like people in ICU that were like vented were getting chemotherapy.
Wow.
Or people that had multiple resistant infections with open wounds that had no immune system and they were on their deathbed getting chemotherapy. And that's at that point, my childhood friend got colon cancer. And I was also diagnosed with hepatitis C. So at that point, that's when I started really, and I started with diet. That's when I really started to research just diet, and alternative therapies as well. But I've really focused on diet. And that's when this whole other world opened up to me. And I realized there's non-toxic treatments out there that kill cancer cells without harming healthy cells. Then I started to question, why is this not explored? Shouldn't we be super excited about this?
Yeah.
Wow, this is great.
And we should be. And most people are when they learn it. The problem is it's the pharmaceutical companies that are not super excited about it.
That's right, because it can't be patented and they can't make money on it.
Yeah.
So more and more as I went to work and started to really change my paradigm, seeing actually what was really going on with these patients, that's when I started to think, wow, I can't do this. And I was sharing, nutritional information with the nurses, what I was learning, talking with the patients about good nutritional, practices.
Time to take a nice swig of your green juice and walk around. Meanwhile, I just want to thank all of you for listening and ask for your support in any way that you can. If you feel so inspired, you can donate via my website, vidalspeaks.com. There's a donate banner there. And while you're there, don't forget to use that Amazon banner for any of your shopping needs. It doesn't cost you anything, and Amazon throws me some commission, so it helps support the show. And any way you can do that, I really appreciate that. Also, can you share the show with one friend this week? Thanks a lot. Now sit back and let's listen to the rest of the show. Here we go. Why do you think that they were giving chemo to somebody at the end of life? Is that a financial thing?
That's the only conclusion that I can come to, because it just does not make good medical sense. It goes against the Hippocratic Oath. And because I know, and I know the doctor knows, this is going to push them over the cliff.
That's terrible. That's really
It
terrible. So what happened with your childhood friend? As you started learning nutrition, did you share it with her? Did she do some alternative things, or did she do the traditional route?
I didn't really know enough at that point to really assist her because I was still doing research. And the amazing thing is I'm an oncology nurse and it took me a long time. Imagine how much information a person has to process that doesn't have any medical background. So I didn't have the information to really help her. She did pass away not too long after her diagnosis. She went, I think, probably a couple years. She had a bowel resection. That means they take out a part of your bowel where the cancer is, and they reconnected her. Then she got an infection from that, so that took time to heal. Then it went to her liver. They took out part of her liver. She developed an abscess there and had to have that drained.
Gosh.
She was so worn down by the chemotherapy and she suffered.
It must have been such, I know I can tell you're emotional about it, but it must be the fuel behind your desire to see other people not suffer when you have to see someone like your dad and now your best friend die of traditional treatment. That has to be a big reason for your enthusiasm to learn a more humane way as a nurse. And as a caretaking person, I can only imagine how painful that was for you to watch your friend. I've been there and I'm not a nurse, but it's so painful to know that there's a better way and then to see someone choose a different way. Oh, it's.
Yeah. And the irony is, as kids, we were teenagers, and that was in, the late 60s, early 70s. And that's when marijuana was pretty available. And so we grew some plants and we would bake brownies and things like that. I know. And come to find out, cannabis can help in cancer. Cannabis can kill cancer cells. Are you kidding me? It was right at our fingertips.
Yeah.
And they've known this and they didn't tell people. And that really blew me away. And then I met two people in one day that told me cannabis cured their cancer. One was a gentleman that had mouth cancer. It metastasized to the jaw. He was fairly young and they wanted to remove his jaw and part of his tongue. And he said no. And he did cannabis oil and it cured his cancer in 4 months. And then another nurse told me she had lymphoma. And she didn't even change her diet. She just did the cannabis oil and it cured her lymphoma. She didn't change her diet till after she realized, wow, she didn't even think it would work.
Yeah, see, all the listeners just heard Rick Simpson about a month ago on my podcast, and he talked about 5,000 cases that he's seen cured cancer. So we've known about this for a long time, and certainly that's the scary thing is now that they know more people are knowing about it, they're trying to squash it, make it not available, put it in the hands of pharmaceutical companies when it's like Rick Simpson says, it's a farm crop. We should be allowed to grow it in our backyard and use it how we want.
That's right.
But they're not allowing us to do that. So you got to kind of go what you think makes you feel like you're doing something illegal to go find it. But people are more willing to do stuff today because they're more open to doing alternative things first versus, say, maybe 20 years ago, they would do the Western way first. I think in cancer, more people are still doing the Western way first because they're feared into it and they're scared into it. But still, more and more people are investigating natural methods. Let's put it that way. They're curious about them. They're looking what's out there. So I'm happy that you've had some experience with that. That's cool. I'll get to that later, some of the things that you use. But what it's sounding like is as your career built, it feels to me like you had a really good foundation of what the immune system is. And by knowing that a healthy person means they have a healthy immune system, it started right from the beginning not making a lot of sense to put some really, really toxic substance into a person to weaken their immune system as a way to try to get them better. And I've talked to other people and healers, and they all seem to have what you had. There was something about them that said, that doesn't make sense to me to put a poison in and lower my immune system or kill my immune system to get better. So that's a really good point. And I think that base came from you and then your experience with your friend, I feel like, she's driving you in the direction to help other people not suffer like she did. I always feel like, hey, it's like I feel so strongly to get the message out about flu vaccines because there's so much thimerosal in them. And for me, it's in memory of my mom, in honor of my mom, because there's so many people out there that don't know it and they need to know this stuff.
And I want to say something about that to the listeners. I have taken care of many Guillain-Barré patients that have become paralyzed from flu vaccines. So don't just assume they are safe, because many people have suffered greatly because of it.
Yeah, and there's an association for people who, if you survive Guillain-Barré, most don't. But for a while, our family, and when my mom was not able to walk, we go to these meetings just to learn more about it. Couldn't believe how many hundreds of people in that room were damaged by the flu vaccine. Just freaked me out. And even yesterday, I'm at CVS drugstore to go get some hydrogen peroxide and standing at the counter, and the girl goes, "Have you got your pneumococcal vaccine yet?" And there's like 10 people in line. I can just kind of feel my blood boiling because I'm so resistant. Just let me choose, but don't ask me, And I said, "No, that won't be happening today. My mom died of a flu vaccine." It just came out and the girl looked at me like, "Whoa, really?" Like,
yeah,
like that's a shock. Like they've never heard of such a thing.
We're not making the connection.
Exactly. But I tell people all the time because I want them to realize it's not, look, you're a nurse and you saw it a lot. So it's not a fluke. I don't believe that it's a fluke.
And there's a lot of, there's not only mercury, there's aluminum in the vaccines, in injectables.
Well, that's really the problem with vaccines is what they're putting in. And mercury is only, the thimerosal is only in there as a preservative. It's not needed. Right. It's absolutely not needed. It's only a preservative. It's a money-making thing. They could take it out, and they're lying to people saying they take it out. I'm going to have Dr. Andrew Cutler on the show in a few weeks, and he's the thimerosal expert. So that one will be in honor of my mom for sure, because I need the listeners to know. That's the thing, Valerie, is people just need to be educated. That's why it's so great what you're doing, because not only are you educating people, because you've been on that side, you've been the one treating people who've chosen chemo and radiation, and you have this really strong medical background. And if you say to somebody, "Look, I've seen thousands and thousands of cases, there's a better way to do this," people are going to listen more. But not only that, your new business where you coach them, that's so great, because that's what people need. They need support to go through this. They feel alone. Many of my friends that have been diagnosed with cancer, their families won't even support what they want. Their own children, their husband. It's been such a difficult place to see somebody who wants to do a certain thing and then feels pressure from their immediate family to do something else. So when you have a coach or a mentor like what you're doing, at least you have somebody that's on the same wavelength with you that maybe can help explain things better to the family and honor what the person wants and give them options about when a medical treatment would be necessary or when it's not necessary. I think it's so great what you're doing. It's really wonderful that you offer this. So I'm so happy you left and you're doing the work you're doing, because it's really, really needed to find people to support cancer patients through natural treatment.
And when I saw that people were actually better, from doing natural treatment, when I started to actually meet people that had healed using natural therapies, and when I saw that firsthand in the hospital, when one of my patients got better when he started taking vitamin C, his whole rash cleared up, and meeting the people that had healed themselves, I remember standing at the nurse's station saying to myself, I've got to find a way to get on the other side and help these people, because I couldn't do that on the oncology floor. I couldn't talk about it.
Yeah.
So I had to find a way to get to it.
You had a patient that you gave vitamin C. Was it just by mouth or vitamin C IV?
Yeah, the wife requested from the doctor to try some vitamin C.
IV?
Yeah, she first requested an IV, and the doctor said, well, we don't even do that here. And I knew, I was in the room. I knew that was not true because I've given vitamin C as a rescue drug in chemotherapy treatments. There was actually a treatment out of UCLA that used arsenic, and vitamin C was the rescue drug. Mm-hmm. So I knew that wasn't true because I gave it. And he was recommending more chemotherapy for the patient who was very ill. So he did concede to trying some oral vitamin C. I think it was 500 milligrams twice a day.
Oh my God, that's nothing.
I know, that's such a low dose. But it was astounding how much it helped.
Wow.
I was amazed. His rash cleared up. His mouth stopped bleeding. The blood that was in his urine cleared up. And his mouth was so cracked. And it was just torture. And it cleared up in a matter of days. And I was just amazed. So then the doctor did a blood test to measure his vitamin C levels in his blood. And it came back low. So that gave him the justification to do it IV. So he did start him on, I think it was like 1,000 milligrams IV.
Which is still nothing.
I know. And so that really helped him. I mean, his rash cleared up. He was much more comfortable. Like I said, his mouth and gums were bleeding. That totally cleared up.
Fantastic. It's almost as if he had scurvy or something for it to work at such a low dose.
He did have scurvy. That was another paradigm shift for me. Okay, so this patient didn't have a rash and bleeding gums from cancer. He had scurvy because his vitamin C was completely depleted from all the stress his body went through. Because when we go through stress, it depletes our vitamin C. We use up our vitamin C. He was completely vitamin C deficient. He had scurvy. And the dermatologist that was caring for him knew this because when I mentioned how remarkable the results were from the vitamin C, and I talked to him about scurvy, he acknowledged, that it was scurvy and that you could tell because the hair on his arms was growing in a corkscrew fashion, and that's a sign of scurvy. And he knew this. And I was stunned, really, when I was talking to him that you actually knew this and he wasn't getting this a long time ago. And he said to me, "You're not one of those, are you?" And I looked at him and I said, "Yeah, I am." And that's when I realized there's a peer pressure and it's totally unspoken. We never, but to mention nutrition, to mention nutrients as actually being that effective is really, you're looked at like stupid.
That's really a shame. What a pity. Yeah. And that needs to change.
Yeah.
So why do you think people put such blind faith into what doctors say?
Well, because they're supposed to be the ones that are trained in this. Trust your doctor. It's in our culture. It's embedded in our culture. And especially from like the 50s, life through chemistry is better, right? That's when they started using all the chemicals.
Right.
And it's fed to us through media. Yeah. We're brainwashed.
Do you feel like in the oncology field that people are putting even more faith in their doctors because it's such a serious disease?
Yes. And they're not offered anything else.
And sadly, when the patient has done their own research and they say, I read that vitamin C IVs can help cancer, and they tell their doctor, no, that doesn't have any effect and don't go do anything. And they scare them. When my mom went to the Mayo Clinic, the Mayo Clinic said, "What? You're doing homeopathy? Stop immediately. No more remedies." And I'm thinking that doctor has no idea that homeopathic medicine is energy medicine. It's not even substance.
Uh-huh.
But, they believe it's herbs and it could be dangerous. And herbs are medicine. They're natural medicine. You have to know what you're doing. Mm-hmm. But if he's not a specialist in it, then he doesn't really have a right to tell the patient that they shouldn't do it. What they should say is that you should consult with a specialist and see if they feel that it's helpful in your condition. But instead, they just scare the patient into saying that it's dangerous to do nutrition or any alternative therapies. And that's where I feel like it's absolutely wrong.
Right. And because the doctors aren't educated about the different herbs and natural substances, they just tell them, no, don't do anything. It's going to interfere. Instead of saying, well, have your herbalist call me. Let's work together. They don't even want to deal with that.
Exactly. But I think that's where it will have to move in the future, just to integrate, because it can't stay the way it is. That's for sure. So now looking back over all your years as an oncology nurse, would you say chemo and radiation are effective?
No, I wouldn't. And we need to move toward non-toxic treatments. So that's where we must move to. We must move to immune therapy, non-toxic immune therapy, and non-toxic treatments, and giving our, the folks facing cancer choices. And I know that because people are becoming so much more informed now, that's what they want. That's what they're demanding. And so I know the pharmaceutical companies are like, okay, how can we make money on this? What can we do? What can we develop and patent so that we can do that?
Well, let's talk about that for a minute. This evil of chemo regarding money. Can you speak about how it works and what kind of profit the doctors make?
I don't have actually the statistical number. Is it 6% that they profit from the chemotherapies?
I thought it was 60.
60? Yeah, I'm not sure exactly what the percentage is, because as nurses, that is not even on our radar at all. I wasn't even aware of that for so many years. Not until I left, actually, oncology was I really aware of that. So it's not talked about. But I do know they make most of their income, or a large portion of their income, from the chemotherapy, from the profits of giving the chemotherapy. So that's my conclusion, that that's the only reason somebody on their deathbed would be getting chemotherapy.
Do you think it's true what that article that came out in the JAMA journal that said they interviewed a bunch of doctors, and 85% of the doctors that administer chemo to their patients said that if they or their family got cancer, they would not use chemotherapy?
Right. Yes. Yeah. I've read that. Yeah.
And that was in the JAMA journal.
Yes. Yeah. And that was quite a few years ago that came out too. And then they did the study comparing the benefits of chemotherapy, and the study resulted in 2.3% benefit from chemotherapy.
Wow.
In the 5-year survival rate of patients. That was an Australian and USA study.
Why do you think some people get well after they do chemo? Do you think it's in spite of, or that's always the hard point, because someone will say, well, I know 3 people that did chemo radiation and they haven't had cancer in 15 years. Yeah,
that's pretty amazing. And I really do think they're very lucky. And I wonder, how much easier their cancer would have responded to natural substances. At some point, their immune system had to have kicked in and taken care of them, because that's the only way. So despite the chemotherapy, they made it through.
And there's probably a very small percentage of people in the long run, especially with metastasized cancer, that have an immune system that can rally like that after such a toxic treatment, I would think.
Yeah. And there's stem cells. So their stem cells, if we had measured their stem cells, their circulating stem cells were probably really low. So they had surgery. They took out the primary tumor. Their circulating cancer stem cells were low. So the immune system took over and took care of it.
That's a good point. I've never really thought about that, because that's something we forget about, is this number of cancer stem cells. Someone could have a high amount. So right after chemo, they get their cancer right back because the stem cell amount is still the same.
Yeah.
And someone could have a very low amount and then they could live much longer. Let's talk a little bit about those statistics, because they're really skewing the statistics now and not really giving accurate measurements to patients. And I think this is a difficult thing too, because now they've introduced a stage 0 for breast cancer, and stage 0 would have basically, that's not even a cancer. That's like saying you have a pre-cancer, right? But they're putting stage 0 in the same category as stage 1, stage 2, stage 3, stage 4. So if you're like 4, what does it go? 4A, B, C? Does it do it like that?
Yeah.
So 4C is that the lowest?
You know what? I'm not sure. So
well, let's just say like they have, let's just keep it in stages. Let's just say, because they throw stage 0 in with stage 1, stage 2, stage 3, stage 4. So if you go to your doctor and you're in stage 4 colon cancer and you say, okay, what are my odds if I do chemo? And the doctor will say, you have to do chemo because you have a 71% chance of, I don't know what they say. Like, is it 5 years? Do they even tell them that? But they give them this number.
Yeah, they use words. They use words in kind of in a deceptive way, maybe, or not a very clear way. Response is a word that they use. We have 100% response or an 80% response while using this chemo. People think, wow, that's great. Response, I'm going to respond to this and it's going to cure my cancer, right? No, wrong.
Yeah.
A response could mean we lower your tumor burden and it can last for 1 day. That could be an 85% response. So that doesn't mean anything.
And if they even went and said, you have a 70% chance to be 5 years, to go 5 years. But if you're including stage 0 with stage 4, of course, stage 0, the odds of them living 20 years is probably high, maybe even longer. But a stage 4 isn't going to have the same as a stage 1. So they're throwing in like every single cancer patient and averaging them out, where that's just skewing the results, because a stage 4 can't have the same percentage as a stage 0. That's crazy. But,
yeah, that's right.
But nobody knows that. And I know when they find that out, or if they're research oriented and they do the research, often when they say, okay, well, what's the percentage of all people with my stage cancer, stage 4 colon cancer? Then what's the percentage? Oh, well, it's 14%. Okay. Well, that would make people make a different choice.
Mm-hmm.
So
right.
I feel like that's very deceptive. And I know I've had a couple cancer patients on that talked about the statistics and how they were so misled. And it's one of the things that people use to make the decision of whether to do chemo or not. So I just want to tell our listeners out there that before you believe a number, you need to look it up and talk to people who maybe can help you figure out if that's really true. Because usually the statistics are not accurate at all.
Right. They're pretty skewed. So you need to do your research.
I know for many of you out there, some of this info about the corruption inside our cancer industry is a surprise. Sadly, we're lied to about the real success rate of chemo. The statistics they tell you when they push chemo on you are far from accurate, because they're not measuring them against others with the same stage cancer as you. They're throwing in all the stage 0 and stage 1 cancers in with the stage 4 cancers. So of course the results will be way higher than they are in reality. They never tell you that chemo will never kill one cancer stem cell, and cancer stem cells are what are circulating in your blood. So if you happen to have a lot of them, then you'll have a reoccurrence no matter how much chemo you do. There are so many natural or MD alternative cancer doctors against chemo for this reason. Many people in the alternative cancer treatments have come up with a list of questions. I found one that's the 12 questions to ask your doctor when you're diagnosed with cancer and they're recommending chemo, and 10 questions to ask if they recommend radiation. I'm going to post these in the show notes for you guys, because this would be a great resource to have with you, just to get the real facts and the whole story of chemo and not just what your doctor is going to tell you. I've heard some doctors kick the patients out of the office when they ask these questions. That tells you something right there. Hello, time for a new doctor. Anyway, next week in part 2, we're going to discuss in great detail the tests that Valerie recommends that are pretty cool because they tell you so much about your cancer and what will work for it. I loved learning this from her, and it's really a fantastic resource. So be sure to stay tuned for part 2. Meanwhile, eat an organic whole foods plant-based diet, detox on a daily basis, sleep well, exercise, laugh, love, and live life with some passion, and you'll be on your way to good health. That was a lot of information for today, guys. But I hope you enjoyed the show, my podcast family. You know what time it is, right? Yep, it's time to say goodbye. Vidal has spoken. Remember, you heal with a plant-powered diet, homeopathy, and detoxing, of course. Peace. Be healthy. Be free. Live life.